Hi, good afternoon. So I've been having a little difficulty logging in today, and so the delay, hence the delay. Today's question that has come through info@jayo.com, and remember that's where you can send me all your questions. Most of the questions are coming from readers of You Are the Universe, Discovering Your Cosmic Self and Why It Matters. But as I said, you can send me any questions you want to. I'll do my best to answer them. They're placed in a queue, and then I answer them in the order that they were received. Once again, the email where you can send these questions to is info, I-N-F-O, at jayo.com. Info at jayo.com. info at jayo.com. So today's question and comment comes from Margie Hunter, and I'll read her email to you. She says, Namaste. Dear Dr. Chopra, Namaste. As I write this, I write it with a deep sense of gratitude. I was diagnosed with multiple sclerosis in 1999. It was very aggressive. Some months after the diagnosis, I listened to a CD in which you spoke of how the body regenerated and the power of our thoughts on the body. You spoke of having a center, so I looked you up and I went to La Jolla. Well, that center is now relocated to Carlsbad, where I am right now. I'm in my office at the Chopra Center for Wellbeing, no longer in La Jolla, but in Carlsbad, California. I spent the whole day there with Dr. Simon and an Ayurvedic practitioner. I learned about meditation. I had Shirodhara and other massage and yoga therapies. This was a completely new experience for me. For the first time since being diagnosed, I felt relaxed and strong as I was driving up the coast to go home. Prior to hearing you and experiencing all of this, I had thought that all this integrative stuff was not real, but I soon learned how wrong I had been. Fast forward to today, 18 years later, I haven't taken any medicine for MS in the past 13 years. I'm stronger and healthier than before the diagnosis. My last MRI showed the lesions in my brain are gone. I practice yoga every day and teach yoga twice a week. My pranayama and meditation practice have become an integral part of me. By the way, there's a new pranayama app with Eddie Stern and me that has just been released today. You can go to iTunes and you can download it. It's called the Breathing app. Okay, I'm going to continue reading this. The results of all this and the knowledge that this universe has and always will very well support me and have compelled me to give back. I have published a book to help others with chronic disease. Really, I believe it would be beneficial to anyone. I speak of my journey with MS and transcending the disease in the first half of the book. The second half is a step-by-step guide to wellness and harmony through asanas, learning to breathe correctly, and pranayama and meditation. The title of the book is Transcending MS. You were the light which was gifted to me that led me to wellness and being able to write this book. I can't begin to describe how that changed my life and as a result the lives of so many others. The ripple has been extensive. I would like to send you a copy of the book. Please let me know where I can send it. Hari Om, in gratitude, Margie Hunter. So Margie, thanks for sharing this. I will send you the email where you can send me the book, the address by an email after I finish this podcast. And thank you for sharing your story. And now I will try and comment on your story as much as I can, because what you say is very, very interesting and very, very remarkable, and I think we should all learn from it. First of all, if you look up multiple sclerosis, you will see that it's considered a potentially very disabling disease, and it's of the spinal nerve cord and also of the central nervous system. In multiple sclerosis, the immune system attacks the protective sheath that covers nerve fibers, and this is called myelin. This causes communication problems between the brain and the rest of the body. From what we know, eventually the disease can cause the nerves themselves to deteriorate and become permanently damaged. The signs and symptoms of multiple sclerosis, of course, vary widely from patient to patient. They depend on the amount of nerve damage and which nerves are affected. Some people with MS lose the ability to walk, to be independent, and they have problems with urination, incontinence, bowel control, etc. According to current medical literature, there's no cure for multiple sclerosis. That's what you read about in medical textbooks. Current treatments can help speed remission and recovery from attacks, modify the course of disease, manage symptoms, etc. Some of the symptoms of multiple sclerosis that people are familiar with or know about are numbness, weakness in one or more limbs, partial or complete loss of vision, sometimes in one eye, sometimes in both eyes. Often there is pain when people move their eyes. There's tingling in various parts of the body. Some people feel like there are electroshock sensations. There's tremor, lack of coordination, unsteady gait, slurred speech, fatigue, dizziness, problems, as I said earlier, with bowel and bladder control. The disease course is variable, and a lot of people have spontaneous remissions, and then they have relapses, but eventually it gets worse and worse. The exact cause of multiple sclerosis is actually unknown. It's considered to be an autoimmune disease in which the body's immune system attacks its own tissues. In this case, of course, the tissue that's attacked is the myelin, the fatty substance that coats and protects nerve fibers in the brain and spinal cord. And myelin is like insulation for the electrical wires that we call nerves. Most people who get multiple sclerosis are between the ages of 15 and 60. Women are twice likely to get it, and some infections have been linked to it, including the Epstein-Barr virus. It seems more prominent in white people of Northern European descent. I remember, by the way, when I was in medical school in India, I never saw a case of multiple sclerosis. I believe now it's also found in India, but as a medical student, I read about it, but we had never seen, so it was very rare. But now apparently it's getting more prevalent in India as well. It seems to be more common in smokers. Lots of times there's depression, sometimes epilepsy, paralysis, muscle stiffness, pains, etc. There is no exact treatment for this. There are treatments that are used, including steroids and immunosuppressives, and on and on. But I want to address now what may have happened in the case of Margie. So, as you know, I've been speaking recently a lot about inflammation in the body as a background in almost every chronic illness, including autoimmune illnesses. Inflammation is often, of course, connected to stress, but also linked to poor sleep, linked to poison in the food chain, including chemicals and also insecticides and pesticides, and also maybe in the food inflammation could be a result of other contaminants, antibiotics, hormones, steroids, and other chemicals. So refined, manufactured, processed, hyper-processed food, sugar can all lead to inflammation, including dysbiosis, or the inflammation of the microbial genes, and maybe epigenetically connected to methylation, deacylation, etc. But diet can cause inflammation, poor sleep, stress management, and then there are so many other things that can cause inflammation, including if we are having unhealthy emotions, which can be anywhere from fear, hostility, and people have yet to look at the role of other emotions in inflammation. But we know now that even violence in society is linked to inflammation. So Margie was very fortunate in that when she learned yoga and pranayama, she probably started to override her sympathetic overdrive, stimulate the vagus nerve, cause therefore a shift in her biology from inflammation to homeostasis, and that obviously must have helped us. She did yoga, she did pranayama, she did Shirodhara, which is a very precise technique for relaxing the body and also getting over stress and decreasing sympathetic overdrive, and also the massage, which may have affected neuropeptides and also caused maybe stimulation of oxytocin, dopamine, opiates, serotonin, anandamide, which also happen to be immunomodulators. So we don't know what precisely may have happened, but what certainly happened is this holistic approach moved her in the direction of homeostasis, away from the inflammation, probably changed gene expression through epigenetic markers. We also know that in multiple sclerosis, stress frequently causes exacerbation of multiple sclerosis. We also know that there are remissions that happen in multiple sclerosis when people have some way of overriding their stress, or change their diet, or start to do yoga or pranayama. Doesn't matter what the cause was. The fact is we know that we can't break the body into bits and pieces. Your mind, your brain, your sympathetic nervous system, your parasympathetic nervous system, which includes vagal tone, your microbiome, your brain neurotransmitters such as the ones I mentioned, dopamine, oxytocin, opiates, anandamide, serotonin, your immunomodulators, cytokines, they're all part of one system. I would like to call that the healing system, which, by the way, is the topic of our next book, my book with Rudy Tanzi. It's called The Healing Self, and it looks at the mechanisms by which our lifestyle affects, amongst other things, the immune system, and how that affects the play between inflammation and homeostasis. Remember that the immune system, if it's overstimulated, can cause autoimmune illnesses, allergies. If it's understimulated, then it can lead to compromised immune function and therefore frequency of infections, and also other things. An understimulated immune system might increase somebody's risk for cancer. So Margie's case is not unusual. This has been known to happen not only in multiple sclerosis, but in bronchial asthma, in rheumatoid arthritis, coronary artery disease, autoimmune illnesses in general. Remissions are known, and also very rarely remissions are also known in cancer. Our next project at the Chopra Mind Brain Institute is to study inflammation, all the causes of inflammation, from what causes inflammation in the mind, in the brain, in the body, at the level of the microbiome, at the genetic level, at the level of epigenetic markers, and how inflammation ultimately leads to also violence in society. This is going to be a worldwide project dealing with inflammation. In the meanwhile, it doesn't matter what disease you have. You should minimize inflammation in your body. And my 6 pillars include, of course, healthy sleep, stress management with meditation and other techniques, including massage, visualization, laughter therapy, anything that helps you alleviate stress. Then, of course, healthy emotions like love, compassion, joy, equanimity, good food that is basically farm to table and is not contaminated with poisons. And the 6 colors of the 6 tastes of life, sweet, not meaning refined sugar, but the natural sweetness found in complex carbohydrates, sweet, sour, salt, bitter, pungent, astringent tastes. 7 colors of the rainbow in your food, which guarantee micronutrients, and all of this helps. And recently we've been looking at grounding and inflammation as well. Stay tuned for the research on grounding and inflammation. So once again, those 6 pillars are sleep, stress management, movement and mind-body coordination, emotions, diet, food, and grounding. Stay tuned for more research on this and more information on this as we work with many institutions to bring down inflammation in our world. Inflammation is a protective response. Acute inflammation is protective when we have an injury, but chronic low-grade inflammation probably is the common factor in almost every chronic disease. As I've said before, only 5% of disease-related gene mutations are fully penetrant. That's where future research in genetics, including gene editing, will probably help. But in the meanwhile, let's all do what we can to decrease inflammation in our bodies. Let's share stories like Margie's with each other. And Margie, I will send you an email with the exact address where you can send me a book. I shall read it and I will be happy to promote it. Thank you so much for joining me today live, and we'll be in touch. If you find this information helpful, please share it with others, and please share this video with others, and let's spread the word to live a healthy lifestyle. Let's help each other, and ultimately let's decrease inflammation in the world, which is leading to so much violence in the world as well. So wishing you all a wonderful day, and let's set our intention together to create a more peaceful, just, sustainable, healthier, joyful, and happy world. Thank you so much. So before I finish, I need to take a 15-second break and come back. Okay? So thank you for allowing me to take that short break. Now, please share this information with everyone. But I also wish to tell you that I am thinking now that the only way to tackle chronic illness in the world is for collaboration. When you have an open system, when there is total transparency, when there is shared vision, when there is a diversity of talent, scientists coming from different disciplines, physicians coming from different disciplines, and even when artists get together with scientists and we all have a shared vision and a shared goal, and we are spiritually and emotionally connected, when we are totally transparent, when we are playing with an open system, then there's a solution for everything. And I think we are going to have a solution for chronic illness in the next few years. And that will be a great help in creating that peaceful world that we want, that sustainable world. Even climate change is inflammation. Thank you, and we'll speak again tomorrow.